Hi, it's Leah here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County. So if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody. Good morning, Dr. Pannozzo.
Good morning.
Good morning, Freddy.
Good morning.
Or as we call him, Freddy, Amp2.tv. We got Linda back. Good morning, Linda.
Hey, good
and
morning.
we always have our producer sitting right there looking at me. Hi, Colleen. Colleen doesn't talk. She just waves. Okay, so, Doc, anything new about some patients that were in this week? We were talking on the way up here. That lady that came in, the model with knee pains, which you keep telling people that models get pains just like everybody else.
Well, the beautiful people all get pain.
I know. That's why I go to you. I'm one of the beautiful people.
What models? What are you talking about? Set this thing up.
Yeah, Dr.
Pannozzo
Pannozzo told me.
This model came in with a knee pain, and I told her a model cannot afford to have any scars anywhere.
That's correct.
If they're going to be beautiful, they got to be beautiful.
Mm-hmm.
So we took care of the knee okay, and she'll be back tomorrow for another reason. But yeah, there's no reason to have a scar anywhere, especially with knees.
And that's one of the things that I always want to talk to you about, because I see so many people who have those problems with their knees, and they listen to their doctor, who sends them to another doctor, and who sends them to a therapist, and I should say a therapist, for therapy. Why don't the insurance companies say, wait a second, all this money we're paying everybody, and we have this guy who's in Delray who's curing everybody, why don't we use him?
Well, I don't think they're permitted to do that.
Why?
Well, because it's their code or the law. I don't have any idea. But apparently that's what it is. They don't push people to special services.
Have they ever come down to see what you
What they
do?
do is eliminate people from special services. That's what an HMO is about.
Right.
And the HMO, if that's your policy, get out of it, because you're going to lose.
Well, let me ask you a
They're
question.
tightening restrictions, so you can't do anything with an HMO person.
Oh, HMOs are tougher now than they've ever been.
The doctors in there are not the best, and they're
No.
working for less money when they do work, and they don't do anything because of that.
Well, I
So
heard
that the insurance company just keeps all that cash. I mean, they don't pay anything out.
Is it a change in Obamacare now? Because I heard that doctors are complaining that it's going to cost maybe 3 or 4 times the amount of money.
Right.
Because Obamacare is in the second year and it has a big change to it.
Well, I don't know about the politics of that, but it's true. It's costing everybody more.
More
I
money.
mean, that Obamacare is a killer. You know why the stock of the insurance companies is way up? I mean, just look.
Making a lot of money.
They're keeping the money. That's why they're making tons of money, and people are paying huge deductibles and co-pays, and before you get to your insurance money, you're cured already. So that the insurance company just keep your money. That's all. And this, you can make up your own mind why the stock prices are up, but I think what was it? Cigna is over $200 a share. I mean, that thing used to be $24, $36, just like that.
But wouldn't they make more money? I'm just playing devil's advocate. Wouldn't they make more money if a patient went to you instead of having to have big bills for surgeries? I mean, scoliosis is almost in the hundreds of thousands and they say you can't cure it.
Well, they don't recommend anything. They just refuse to pay.
Right. Oh.
See, that's how they control it.
But it's Sure would be cheaper to me if I could go there and
But it's not a good. It's not run by good business people, I don't think.
Well, they're making a fortune.
They're making a fortune, so
they're pretty good business people.
I think
It's
consumers
political,
already.
though.
Yeah.
Remember how Obamacare got passed? The insurance companies agreed to all that.
That's right.
okay. Yeah.
Knowing full blast that they were not going to spend any money.
That's right. So they're making a fortune.
So they're making a
it's
fortune
consumer
because
that
of the
actually
law.
is paying for this.
That's one of the reasons to get rid of the law. I mean, all that money should be used for patient care, not to make their bottom line good.
So here's what I've always wanted to ask you. Okay, now, you know me, I sometimes ask questions that I shouldn't ask, but it's the only way I'm going to get my own answer. Why an educated man who's actually curing things that are said cannot be cured is not written up for a Nobel Prize? I mean, come on, you're
I don't know
curing.
what you mean by that.
Okay, how come they're not putting you as one of the leading physicians in curing diseases that can't be cured? They say you can't cure a migraine, but you've proven you
Well,
can.
it's all political.
Well, how do we get people to know who you are?
Well,
I mean, we do it on this radio show, but I mean, come on.
This is why we have a radio show.
Yeah, I mean, let me ask you a question. If you're reading, I'm talking to Freddy now. If you're reading someone you know has scoliosis, and you're reading that it can't be cured unless you go get the rods, and now you see this guy who's curing it, and actually has documented proof of a bunch of patients, not just one. What would you do? Would you see him?
Well, Les, I got Dr. Pannozzo's scoliosis film on my phone.
Yeah, I know.
So when I talk to people about what he does and I show them my phone, they think it's trick photography.
I know.
They think I'm crazy.
But X-rays don't lie.
Yeah, that's true. This is state of the art. This is world class stuff, and it's kind of hard to get it through because, first of all, the general practitioners don't understand anything. The pediatricians, again, don't understand anything. I wrote to 11 of them in this area last year about this. Not one call, not one referral, nothing. And these kids are going for rods. They're going for therapy. They're wasting their time and money. And these
changing
kids
their
are
life.
not being treated properly because of the pediatricians.
Yeah.
I mean, they should at least try it. I mean, what can they lose?
Well, that's the scary part.
I mean, this is terrible.
Well,
Once
as a
those
next
rods
coach.
go in, it changes everything. Yeah, that's a change of life decision.
Well, as a former coach, if someone had scoliosis and they had the rods and at 16, they couldn't play their sports correctly, right?
They can't hard enough time just walking around.
Yeah.
You see, but that's the thing. I think that what the message you're trying to get across is, if it's too good to be true, they tell you usually it is. That's not necessarily so.
That's not true in this case.
No.
Now, everything we do is absolutely true. What we're talking about is true stuff, and you know it. I proved it to you.
I've seen it.
And it's documented. I mean,
Les, it's funny.
Yeah.
Ever since we started doing this show, I guess I've become more sensitive to things around me.
Of course.
So there's a new commercial out that comes out from the spine clinic.
Yeah.
You know the spine clinic people?
The Band-Aid, with that one shot in the thing and they cure your spine?
They have a new one that all the inflammation in your body now has been targeted to the spine. So you go to this center. I don't want to use their name.
No, don't use their name. No.
And they do 120 different tests on your spine, and every one of those will shoot you towards an inflammation part of your body. And I'm sitting there, I'm saying, I've seen the commercial in the past. This one is new. It's all about inflammation now. And we've been talking about inflammation, for almost 2 years?
Yeah.
Yeah, well, people should be careful what they're listening to because that doesn't even make sense. And inflammation is definable. It's either caused by bacteria or virus or injury.
But don't tell that.
Then there's nothing else.
Don't say that, Doc.
I mean, an injury.
No, we're honest.
Yeah, but where is it? I mean, you
No, I
can't
understand.
do hundreds of tests on the spine and find out where the injury is. You have to know medicine. You have to know how to examine people.
But it's amazing that they're even bringing it up now. It was never part of the conversation.
Well, before we get started,
I was going to ask you that.
I was yelled at by a lot of
Yeah,
people.
10
The
minutes into
hotline is 1-800-889-0267. Colleen yelled at me last week for
What
not giving
number
the
is that?
number, and a couple people yelled at me, so let me give it again. It's 800-889-0267. We take every call. We don't screen anybody.
screen nothing.
Colleen just connects it to us, and we answer your question. So again, 800-889-0267. I do okay, Colleen? Okay.
Yeah,
So-
if you want to compliment us, go ahead. If you want to complain,
yell at us?
go ahead.
Yell at us.
Yell at,
I can take a complaint. I'll turn it
No.
right around on you.
Right.
You could yell at Les. I got a comment from last week. Somebody told me, how can Les promise dinner. That's just a crazy bet. Still haven't paid off, right?
Well, you know what? One of the guy that opened up Vegas said, Vegas will never be built by winners. It'll always be built on losers. This is a bet I can't lose. Yeah. I can't lose it. No, but let me preface this so we're on the same page. The pain you come in with, he could cure. Don't call us up when he does your knee and say, you know what, I went to Dr. Pannozzo and my shoulder's killing me. Well, we didn't do your shoulder, we did your knee.
Right.
That's the bet. It's not a foolish bet because, I always tell people if you're skeptical, just walk in his office one day.
So
and
you
just
gave out the number, now they're calling him.
Now they're calling, but I didn't give out his home number yet. And
He's on the air, ladies and gentlemen. Don't call him on his cell phone.
Yeah.
In another hour.
In another hour, you can call my cell phone, but right now, just call him again at 800-889-0267. I always tell people, if you want to talk to Dr. Pannozzo, just walk into his office at 16244 Military Trail, right across the street from Walmart. Just sit in there and just say, hey, this is my first time coming here. What do you think? And I guarantee you'll have 9 people saying he's God. Don't listen to me. I'm nobody. I'm just some kid from Brooklyn who thinks he's a kid from Brooklyn.
I get a kick out of this too because when I'm treating somebody and then they go out to the waiting room and they just raise their arms, I'm great, I'm cured.
and it's funny.
It's really funny, but true.
No, I mean, all you have to do is sit there. When the first time you and I went there, we sat there and said, oh my God, these people where do we sit? Freddie went outside to get some air. I had to come and we had to go back. But you know what? I said, every story I've heard is amazing. And I'm looking at this guy, and he's got a cane. I'm saying to myself, I guess this guy Pannozzo didn't cure him. Guess what he started with? One of those little scooter things with the little thing on it. And from there he went to that thing with the tennis balls on, to crutches, to that. The guy said he couldn't even walk.
Yeah, that's
now
true.
He's walking upright.
Now those people take more than one day.
Of course. No. Yeah, I want to preface there are certain things.
But yesterday, we had a terrific case. Well, it was Friday. Mm-hmm. No, it was yesterday. I came in Saturday to see this guy.
Oh, that's nice of you.
Anyway, he had tingling in the bottom of the foot. Mm-hmm. And I don't know what he was treated for, but they were treating his ankle, I think, or the bottom of his foot. I don't know what it was. Anyway, I examined the foot. There was nothing there, so it had to be from the back. And it took 3 shots in the back, but he had a real pinched nerve there. I mean, that's pretty rare. Mm-hmm. I mean, to have a pinched nerve. I know you hear that a lot, but it's not true. A referral pain is not necessarily a nerve.
Okay.
You can hardly find these things. They're so small. Anyway, so it took 3 shots in his back, and did a little re-engineering of his spine, and he walked out without that tingling.
Now I want
to
stop
That was one day.
I want to stop you right there. We're going to go back to this minute. How were you able to know where the pain was? I know the answer.
Well, you have to know the pain patterns. Okay. You have to know neurology. You have to know where the nerves go, where they don't go, and you have to know other sources of a pain that people will have. And if you don't know these things, you can't really treat that. You don't even know what I'm talking about. But this is the kind of work we do. It's very high level, very sophisticated musculoskeletal work.
Right.
And so if you have a pain that's not going away, or if it's in a place that you don't expect, we'll figure that out. That's what we do. We do diagnostic work. And the physiology of the pain production is in my book, by the way, and I recommend people get it.
Freddie, could you? Where should you hold on? I want people to see it
right now.
Yeah, this was published in 2006, but it is still current on what the patients want to read. The developments for this book are in the scientific sphere for physicians. Like this pain pattern here that we just treated yesterday. You have to know where those things arise. You have to know why they arise, and we figured all that out. It's a physiology of pain production, and so the tissues you have are being misused a little bit. That's why they're painful, and so we readjust the usage of the bone structure and the ligaments, and that pain does leave. And it leaves before you leave the office. I mean, you don't have to have
That's the
treatment
beauty of
after
it.
treatment after treatment. We do it right then and there, same day. So, yeah, that's true. Try it.
This
Well,
is
Leah's one of them. She had
we're
an
going to talk about Leah next.
Yeah.
Yes, we are.
She had an ankle
I would
pain.
never leave.
It wasn't an ankle, and then you got an inquiry about somebody who wanted to.
While you're on
they
the
wanted
subject,
him to wear a boot.
Okay, Nancy.
Don't do that.
No, Nancy from Twitter asked. She saw Leah was going to be given a boot for her injury, and you, Dr. Pannozzo, found the cause of her pain. Cause and effect.
Cause and effect. Yeah.
Okay. This lady said she's being fitted for a boot and have been told if she doesn't wear the boot, the pain in her foot will never go away. How long did it take Leah to get back to work? I could answer this one the same day.
She never lost work.
She went right back to work after she saw you. Okay, and
that's
what
true.
happened when she went to her doctor and told him she was no longer in pain? Was she able to get right back to? Well, you could answer this. I could answer it too. I don't even need you on this one because I was in the office when she was doing it. I brought her up to see you. She was back, I think, in an hour and a half.
Right.
Left you, went back to the station because she's in Port St. Lucie.
Right.
And she's able to do all the things that she did normally. She's able to work out at the gym. She's able to run. She's able to do her ballet and all the other stuff with the kids.
Yeah, the treatments are that good.
And it wasn't in the foot. Explain to I
We're
want
not
you to
exaggerating this. It was
Of
a
course, I was
referred
sitting right
pain,
there.
just like the guy from yesterday. It was
Yeah.
a referred pain from the lower back. There was nothing wrong with anything else, and it was localized and treatable. And before he left the office, that pain was gone.
So if someone goes to a podiatrist, because I guess that's the person that would fix the ankle, because they can't go higher
Well,
than the knee.
you can't go to podiatrists. They're surgeons mainly. They
Right.
don't do diagnostic work,
Right.
and they have no background in neurology, neurosurgery like I do. They really don't treat this kind of thing. They're surgeons primarily.
So the first reaction would be to give a shot in the ankle and then put a boot on. I'm
Well,
trying to understand why.
Wearing a boot doesn't even make sense. You never restrict motion. You don't do that. I mean, you promote motion, not restrict it. Because
you know what? You just hit on something that, for years, the bodybuilders
yeah,
would wear these big belts
Right.
around their waist to lift weights.
Right.
So a lot of them stopped using them and they started pulling their backs. And they went to people and said, what happens is when you lose the belt, you're not strengthening your core.
yeah.
That's what
well,
you've always said. So you're not being able to keep the muscles that hold up the body.
I have an article on the core. I should. I don't think.
Oh,
think
yeah,
I
that's
brought it. Maybe
if you
I
have
brought
that,
it,
because
I
people
don't
don't realize that's how you lift weights. It's the core.
But see, if you do that for backache, the core program has nothing to do with the spine. It has nothing to do with the back, the lumbar spine. Nothing.
You're right.
If you look on there, you say, well, what are you treating here? They're not. They're treating the stomach muscles.
That's right.
That is the least of your problem. Don't do that.
Right.
You find out what part of the spine is hurting you, and get it treated properly.
Mm-hmm.
And you should have it treated in the first day. Shouldn't take 6 weeks. Shouldn't take 8 weeks.
Well, they say
Should not.
that
In
if
my
you,
office, it's 1-2 days, and that's it.
they say if you can't cure a pain in 3 days, this is not me. These are a team of doctors that from the Journal of American Medical Association said, find another doctor.
Right. I say 1 day.
Well,
1 or 2 days. That's it.
Well, migraines is always a 1 day.
Yeah.
You know, doc, you can't cure them so fast because you lose a lot of business.
Well, I don't care.
Yeah.
I don't do this for. I don't do this for.
I know you don't. I mean,
the
this-
fees anymore. I mean,
I just got a question from your chat box on Pannozzo.tv.
Oh, you got one now? Okay, go ahead.
Alan he wrote in the question. Reason he's having hip surgery in 3 weeks, and he'll be out of commission for 4 months on the hip surgery. He wants to know how long does a bad hip take to fix. I'm assuming that he has to replace the hip. That's an assumption on my part. From the
well,
question.
we have to figure out why he wants his hip replaced.
Oh, he
And-
doesn't. He's just scheduled for 4 months.
I know,
3
but
weeks.
we have to find out why he wants that.
Right.
I mean, if you have a hip pain, it's treatable. You see, it's not inside the hip joint that bothers you. It's the ligament structure outside. Those are injectable, and the inflammation there is correctable so that your knee can come out to almost normal. So all of that surgery is not necessary a lot of times. Then you have to figure out if the hip pain is referred from the lower back, which is possible. And then you have to figure out how it actually bothers. Climbing steps is not the hip joint. If it gets better walking, it's not the hip joint. So there's things in history that you could discuss with a patient. And,
What amazes me, and it still amazes me till the day I go meet my buddies up there and play golf, how you were able to determine the pain that Leah had in her ankle and realize before you even examined her that it wasn't the ankle. That was one of the things that totally amazed me, because I was sitting in the office with you.
well, the powers of observation and
Well.
deduction, that's what it is. I watched her walk, and the ankle looked normal to me, so I
Right.
said, it can't be the ankle. It's got to be somewhere else.
It's amazing.
Just like that. See, the good doctors will do that.
Yeah, well, I mean, this is, you know,
You figure, how do they do it? Well, a lot of it's intuition, a lot of it's observation.
And scientific.
You have to know stuff. Yeah.
well, I don't remember. I don't want to mention his name. He told me not to. Remember the gentleman that I was sitting in a restaurant with one of the representatives of a TV station, and I watched him, and he's moving his hand up like this. And I said, "What's the matter?" He said, "I don't know." He said, "My wife had to tie my tie. I got such pains in my elbow." Remember that one? Such pains in my elbow. I don't know what to do. I can't even drive. I said, "Let's go." He said, "Where you go?" I'm taking Dr. Pannozzo. He said, I don't know. He said, the same thing. He said, "What is he going to do?" I said, "If I knew, I'd be doing it now for you." Brought him Dr. Pannozzo. Cost me a lunch, by the way. Now he's buying me a lunch after that. And guess what happened? Tell him that story. You remember that one? I mean, you have so many people.
Well,
he couldn't tie his tie.
He couldn't straighten up his elbow. While I was doing his treatment, the elbow came right down. So we knew we had it there.
Yeah.
Then it took another day for the inflammation to go away, and that was it.
He was
Never
80%.
came back.
Yeah, he was 80% done in the office. I called him the next day to see how he was. He said, "Man, this guy is like a god." I said, "No one." Yeah, I said to Ralph, I'll call him Ralph. No one understands this unless they come and see it. So I'm trying to let people know that this is medical stuff that works.
Yeah, these the procedures we use, like on this elbow, those are created by us.
Right.
In my office.
Right.
We do the research for that. So you can't go down the street
No.
to a surgeon and get it done. They won't know how to do it.
And you've been doing this for a while, right? A couple years?
Yeah, we've
a
been
couple
doing
years.
A couple of minutes.
Yeah, I mean, but now, a lot of people ask me, well, could I go to somebody else who has that same medication that he does? I said, yes, you can. It just won't be cured.
Yeah, medication there's all kinds of things to use. We use a certain kind.
Right.
But it's why and where you use it. It's not the
That's the key.
medication at all. Because there's all kinds of things you can use.
And your medication is FDA approved.
You got to know why and where you use it. Yeah, oh yeah, of course everything's approved.
Right.
We do standard treatment, medical treatment. Everybody else does alternative. I mean, when you go back to the science that we have, and you figure it out, why do things go bad, what goes bad, and how to treat it, that's basic science. So everything else, by pills, by therapy, by chiropractic, that's all alternative stuff. They don't really
But it
have
doesn't
a
cure you,
diagnosis.
but the alternative stuff. The sad part about it, it does not cure you.
And that was the basic of medical treatment until you find out that that's not scientific.
No.
I mean, chiropractic is not scientific.
Oh, well, according to everything we've read, I don't want.
No, there's never been an article stating that the manipulation
No.
does any good.
No.
None. If there is one, I'd like to see it.
I don't want to be redundant and read those 20 things that a bunch of medical doctors talk about chiropractic because,
No, let's not do
I don't
that.
I don't want to bother
it's just,
anybody.
we do basic science here.
It's a science.
We get enough phone calls.
Well, I mean, here's a medical, here's a medical doctor that has taken the test, passed all the boards, worked in the hospital, and decided to go into this field that nobody else is in. Because I'm assuming that most doctors that do surgery make a lot of money.
Well, I don't know about that, what they make, but surgery is not. You don't do that first. You do that last.
Yeah.
Failed medicine, you told me once.
Pardon me?
Failed
yeah,
medicine.
it's failed treatment. Surgery is a failure of treatment.
I want to give a shout out to one of the doctors I met at the gym that says that guy knows what he's talking about, Les. I said, really? I said, yeah, he knows what he's talking about. Too many people because I'm studying to be a doctor, and I'm thinking maybe I would meet him because I might have to go into that field. So, Stanley, if you're out there, I hope you're listening.
Give us a call.
Give us a call
The number last.
at 800-889-0267. We're going to take a little break now, give Colleen a chance to get a cup of coffee and Freddie a chance to breathe, and we'll be back in about a minute and a half. Thank you.
Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into a show Sundays, 11 to noon.
You're listening to Dr. Pannozzo's Sports and Medicine Hour with Dr. Anthony Pannozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pannozzo now at 1-800-889-0267 to get your pain issues resolved. Now, more of Dr. Pannozzo's Sports and Medicine Hour.
Go ahead, Les.
We are back. For those of you who want to go into the chat room, Freddy's here and Gio's out there doing the same thing. Go to Pannozzo, that's PANNOZZO.TV, in case you really don't want to talk and you just want to write in a question that we could answer. Let me give that again, the chat room. Go to Pannozzo, PANNOZZO.TV, and you can type something out, and Freddie will put it on the air with us, and we'll go further. So getting back to what... Oh, you don't have another one, do you, buddy? You have another one?
No, Pannozzo.tv is good. And then ask a friend.
Okay, we have
bring
the
a friend.
Ask a Friend campaign. You bring a friend in and take care of Dr. Pannozzo. We're going to invite you to our broadcasting to talk about how you felt about Dr. Pannozzo. If you didn't feel good about him, let us know.
That's right.
If you feel good about him, let us know. The one thing we try to do on this show is not to take sides. The only thing we want to do is, and everyone here that's at this show has been taken care of by Dr. Pannozzo. Why? Of course, we don't... No, we didn't give that number out, so it's not us.
The other number. That's the wrong number. He'll call you back.
He will call you back on that number, but please call up 800-889-0267. Of course, we're on the radio now, and we can't take telephone calls.
That's right.
Okay.
And you know that it's killing him not to take that
I know
call.
it. I know it's killing him not to take
Look at
the
that
call.
finger. His finger. He got the itchy finger.
Stuart.
Oh, but if he calls now, you ever see Dr. Pannozzo when we're driving home?
No.
So, hey, Les, I got a call. Oh, okay. Oh, yeah, come on into my office. And Wes is going, oh, please, God, I didn't make that last insurance payment. Okay, so let's go back to what we were talking about. We were talking about how important it is to get a second opinion. Okay? I don't know if I'd ever go in for surgery, even before I knew him, without getting a second opinion.
That's right. Nobody should do that without a second opinion.
No, or even sometimes a third opinion.
And if you can avoid surgery at all costs with infection and being allergic to anesthesia and a whole other host of problems, you should.
On one of my research finds, a very well-known doctor who's on the internet said he said surgery should be the final step. If you've exhausted every possibility and none of the doctors you went to could help you, then go in for surgery. They say there's 10 reasons why you shouldn't go in for surgery. And this is not me talking, folks. This is people that you could go on the internet anytime you want. And a lot of people taking things out of context. Am I right? When they read something, they don't read the whole article?
Well, there's a way to read a scientific article.
We talked about the call. Tell them how to do it, Doc.
Yeah, the way I do it is the title gets my attention.
Okay.
And then I read who wrote it. If they're MDs, if they're anything else. And then I read the conclusion. If the conclusion doesn't make sense on what they started, I just forget about the whole thing.
Okay.
If it gets my interest up, then I'll read the article inside how they did it. But usually they're not that good.
Okay, so let's get some more questions.
I got one that just came in on the
another
box.
one. Take those. Those are the first.
Amy just wrote in. I'm a stay-home mom and have been a stay-home mom for 8 years raising my children. I can't work due to pain in my hips. My husband told me to listen to the show, and I watch your tapes on your site. My question is this. I never had hip problems till I gave birth to my 2 children and was told that's normal. My question is, are they telling me the truth? Can Dr. Pannozzo help this specific pain?
It's not normal, no. There's a whole history to take to see if you have hip problems. One is it gets worse as you walk, not better. Okay, that's a hip. Climbing steps is not a hip, it's a hip flexor. So you could separate out the structures involved by history. If the pain goes down to the calf, it's not a hip. It's a lower back.
So childbearing had nothing to do with this?
Nothing to do with it.
Interesting,
whatsoever.
but they told her it did.
I know, but that's ignorance.
I want to give this lady, Dr. Pannozzo's number. Now, the number I'm going to give you, you must call at 12:30, no earlier, and that's 561-381-5800. That's 561-381-5800. And don't be surprised when Dr. Pannozzo answers the call. That always amazed me. You're probably the only doctor I've ever seen that answers his own cell phone, and it's important to you. Why?
Well, the reason is pain is very personal to that person who has it. And if I'm going to help him, I have to understand what this pain is. And I can pretty much tell by a short history on the phone what it is, and then I could arrange for them to come in the office. Now I can squeeze them in or give them a later appointment, whatever it takes. But at least I can do that. I don't have to, my secretary doesn't have to ask me. I'm doing it myself. And it's very personal. Pain is very personal to the person who has it.
I agree.
You don't want to mess around with that. I mean, you want to take care of it.
So let's get to another question.
You have a child there with a curvature, 6 years old?
A child with a curvature. Okay, hold on. Well, why don't I go through all of these things, then we'll probably get to the one with the curvature. Hold on. Here we go. Sarah from Survey Monkey. What a name for a website.
Survey Monkey.
Survey Monkey. And she says, how long are the children you have worked with in the past, and did they grow up and lead a normal life? My son is 6 years old and seems to have the traditional lump on his back. As doctors tell me, he'll grow out of that, but I'm not so sure they know what they're talking about.
He will not grow out of it because it's scar tissue.
Okay.
And it only gets tighter and tighter as you grow,
Okay.
And he'll grow with a curve, and you
Right.
don't want that. You'll ruin the kid's future. Bring him in, we'll treat that. It's not painful, it comes right out.
Oh, I got a call online from, thank you, Colleen, and thank you, Freddy, from Tony. Hold on, Tony. You're here with Dr. Pannozzo. Hey, Tony. Hello, Tony.
Tony's in the wind tunnel.
You're on with Dr. Pannozzo.
Yeah, how you doing, guys?
We're doing
Good,
good,
how are
Dr.
you?
Pannozzo.
I'm probably going to lose you because I'm on the road. I'm going through Boca, and I lose everybody going through Boca.
Okay, talk fast and we'll get the answer for you.
Okay, well, I have the balls of my feet, kind of burn unless I have a little gel pad underneath. And I have problems with my L4, L5. When I bend over, I go to stand up again, it feels like somebody's cutting right through my spine.
Yeah, well, we just described the person that we saw yesterday had the same deal. So, yeah, that's fixable real fast.
Mm-hmm.
Yeah.
Tony, make sure you go see the doctor because
just make an
he'll
appointment.
get right into that spot and remove that pain. You're going to be amazed.
Well, let me give you that Dr. Pannozzo's number. It's 561-381-5800, and you could call him after our show is over. He'll be more than happy, Tony, to
Right.
see you.
Right.
All right, thanks.
Thanks, Tony.
Okay, bye.
Okay, so we were talking about the scoliosis.
I had the same pain when I met you.
Oh,
Remember?
that's right.
Yeah, you had
That's right.
you had a curvature there.
That's right. You did have that. I remembered. Are you still wear your wedge?
I wear my wedge.
Okay.
Which I have a question about the wedge here. Yes,
Really?
And also, but
You-
ask
you-
yours.
Oh, you have one on there first?
Yeah, but ask yours. Go ahead.
Okay, because I think I see Colleen's. No, I thought she was. I think she's taking
She
a call.
might be taking another call.
Okay. The other Pannozzo. You want to speak to the other Pannozzo now?
Yes, indeed.
Okay, other Pannozzo. Here we are. Hey, Paul. How you doing?
Hey, good morning, you guys.
Everything good up in old Arizona?
Everything's great out here, yeah. Getting a little hot, but it's all right.
All right.
Your father's just getting another
Your
phone
father
call.
keeps getting phones on me.
We're going to have to put somebody on his phone.
Okay, you talk while Dad takes a phone call, but go off mic.
Dr. Pannozzo.
What's going on?
We can hear you.
There is,
Hello.
a lot of people have complaint of foot pain,
Foot pain?
underneath that arch.
Okay.
And, sometimes it's hard to tell, where exactly is that pain coming from. But there is a muscle comes down from the calf muscle. It's from the back of the leg, between the knee and the ankle. And it comes down and it wraps underneath.
Still can hear him in the background.
And it gives you, if you want to look at the bottom of your foot, you know how you turn your foot in and up so you can see underneath it. It does that. And so there's several attachments right on the bones that make up the arch. And several times we've had people with had bad foot pain when it's in the arch. And you go after those tendons, and kind of you curve my needle and I kind of move it around there, and it really, it's a noticeable difference. Several times people have a lot of pain with walking. As we walk, the arch flattens a bit, just a hair, and they get some pain under there. But can be pretty debilitating for some people.
Mm-hmm. Tony, that's exactly what I went to see your dad for.
Yeah, no, it's Paul. You're speaking of Paul.
Paul. Tony was the other guy.
Okay.
Paul, that's exactly what I went to see your dad for.
Yeah.
And it's funny because there are times that my calf, when I rub it, I can't touch it. It kills me. But at night, in that arch, there's a lot of pain, and I got to let it settle. But it's exactly what he described when I went to meet you. Unbelievable.
Yeah, but it's either, could be if you find out it's not your back, you know what I mean? If you find out it's not your back, then it could be local down there. But, it can be pretty painful for sure. And
Oh,
it's
yeah.
not ideal.
Freddie couldn't walk when I brought him in to see your
A lot of
dad.
pain. I was crying.
Yeah?
Yeah, the heel pain is not going to be at the heel from that. The heel would be different.
Mm-hmm. Do you have the wedge also? He has the wedge. He doesn't use the wedge.
Does he use the wedge? No.
No.
Wedge helps.
Yeah.
But I tell you that.
If you need it, it helps.
Yeah.
If it
But
doesn't,
I tell you, in the beginning, wearing that wedge hurts, and then after I guess everything synchronizes, it was the opposite side that was hurting. I guess it was putting everything in place.
you
In
go.
balance. Yeah.
And I said, and everybody kept saying, "But then stop wearing it." I said, "No,
No, you can't stop wearing it.
No,
Got to get through the pain."
those are decided by a completely scientific method. You do not argue with that.
Mm-hmm.
If it says to do it, you do it.
And it's funny, Les, because the other side hurt while it was falling into place, and I
Right.
said, "Just got to hold on."
Yeah.
And like 2 weeks later, never hurt on either side.
Well, you're carrying, and you carry Paul. Freddie would always carry a lot of heavy things when he goes for production, and I remember the days when you had 3 interns carrying the bags for you.
That's right.
Now you carry it all yourself,
carry
so
myself.
we know it works. So
Yeah.
you two guys want to confer about anything while I have you both on the air, Doc? Anything that you want to talk about with your son?
No, what he's describing is a prelude to flat feet, and those are treatable. And we worked all this out. You can't go to just anywhere. I mean, we work these out, and we talk about it over the phone, and then when we visit, we look at the procedures that we do. So pretty much we do the same thing. He does more intricate stuff than I do. I
Okay.
don't have the patience for it.
Well, he's younger.
He's younger.
Yeah.
So it's a little bit different, but basically the same thing. So if you go there from Florida, well, you get the same treatment.
Well, why don't you give your number out again so people that are in the area, of course, might want to come see you.
623-776-8686.
Give it one more time.
623-776-8686.
Okay, and that's to see Dr. Paul Pannozzo.
West of the Mississippi. West of the Mississippi.
West of the Mississippi. Are we west of the Mississippi in Arizona?
Arizona.
We have the whole country covered.
Yeah.
Well, I'm going out to Las Vegas and see if I could start something out there for you guys. I mean, those people got to be hurting from falling off the stool when they lose, from sitting on the behind all the time playing roulette and the slot machines. Are you working on anything different now that that you have the time, or any different procedures that you want to talk to us about? That's you.
Are you talking to me?
Yes.
Oh, well, I'm looking at a few things. Nothing that I'm ready to comment about.
Okay.
But, biologics are interesting, that kind of thing. So, we'll see what I like to see. We don't like guinea pigs, though. We'd rather have things decided before you.
That means he's working on something big.
He's working on something that he wants to make sure his father knows that it is.
That's what it is.
The guy talking.
Okay.
He's the guy that we try things out on. We try out.
No, we don't like to do that. We have established things. Actually, all these things are worked out on me first. or Paul. I mean, we work on each other. Where else you going to go?
I've been there when you were getting shots.
Yeah, where else you going to go? There's nobody that is able to do what we do, so it's kind of hard.
It's amazing. It's amazing. I mean, they should, on Mount Rushmore, they should have you and your son. What you guys have created to prevent people from going into surgery, to me, is amazing.
I think so.
I mean, it's something. I never heard of what you did until I met you. And then I wasn't, let's be honest, I saw you, and then I'm a patient of your father's too. I mean, two shots.
That's why we have this radio show.
Yeah.
We're not selling you anything.
No, we have no sponsors. It's just
ideas
us.
on how to treat yourself.
Right.
That's the main thing. Mm-hmm. So if you have a question about anything we're talking about, just
please
give us a call. I'll answer anything.
You can call, you can write in. We're giving you every option for you to be heard.
Okay, so we got some more. Doc wants to get some more questions.
Talking about that 6-year-old kid with a curvature. Yeah, those are treatable right away. I mean, immediately, almost immediately. And people out there that don't know how to do this will say, I'm not telling you the truth. I am telling the truth.
Well, we have X-rays and people that will be more than happy.
Also, we saw a 10-year-old had a so-called club foot.
Oh, wow.
And they wanted to operate her from very young. And I took that club foot right out with a shot one day.
What's a club foot, Doc?
Well, it's a deformity of the foot.
Right.
It's not a definable. Just a deformity.
She couldn't walk on it?
She could walk on it, but it was painful, and they wanted to fuse her ankle. And I said, no, you don't need to do that. I watched her walk. I said, this is where it is. Boom, boom, gone. I saw her 6 months later with another problem.
So she was able to walk with no pain on the club foot?
Yeah, that's right.
Wow. I mean, think about that.
You have to understand how the foot is made, what it's supposed to do, the engineering of it. This is very critical that you know what the anatomy is.
That's amazing.
And how it's being used, and that's why you have a pain. It's a misuse of normal anatomy, right? Mm-hmm. That's what a pain is.
But that's an amazing story.
Yeah.
A club foot that actually has no pain in it.
Yeah, well, these were all surgeons who said you got to be operated, you got to have a fusion. And I said, no, you don't.
Is that because they don't understand the physics of the body or the how the body works?
Who knows what it is? The surgeons are trained in surgery, how to do a procedure without infection to try to get a result. That's what they're trained in. They're not trained in diagnostics and the treatments that we do.
Right.
So musculoskeletal clinic is what we have. And we treat any pain, but we treat the source of it, not the symptoms of it, but where the source is. People get confused because they don't understand what I'm talking about. But believe me, I've been at this a long time.
Right.
I have a reputation.
Yeah. I mean,
so we're doing pretty good with it.
Well, I have a question that maybe both of you want to tackle. Bruce from Survey Monkey writes, I am a sports agent that has played at a major professional level. I'm sorry, I'm reading one at the same time. I'm sorry. He writes, I'm a sports agent that has players at major professional levels. One of them has seen your show and has asked me if you have worked with athletes at this level. I'm going to stop it right there. Yes, we know. We've worked with.
Well, there's no such thing at this level. What does that mean?
I guess he's a professional.
The bodies are the same. I don't care what you're doing. It's the same.
Well, it's probably the way he's controlled.
Yeah.
At a certain level.
In other words, he's saying, like, I'm a professional. Am I allowed to go see you? Well, I have one guy. I use your name.
I understand all that, but there is no difference between the kid on the sandlot and the professional athlete. Mm-hmm. There is no difference. They're all treated
Physically,
the same.
there is
You
no
have to
physical
find the
body.
source of the
Right.
discomfort and why it's there and how you fix it. So it's the same process all over again.
Well, you do know that the major leaguers get better treatment than the minor.
They do not.
Well, in the majors they
I
do.
think that's totally opposite.
Well, the major leaguers, you get Dr. whatever in California to look at your arm. I know kids up here in Port St. Lucie, they're not sending them there to get surgery.
I wouldn't go there myself, but
I wouldn't go either, but I'm just saying.
I think Dr. Paul agrees that the professional players do not get the proper treatments. They're controlled by surgeons. You can't do that.
That's
Can't do
correct.
That's one thing we've talked about before is that the sports teams that have the surgeon there for any bad surgical injury, fracture or something, okay. But the non-surgical things you get just punted off to the trainer, and then they can only do so much. They only know so much, and I don't care if it's what it is. It's slow. You hear people being out, a month with a hip flexor. I mean, that's crazy. That should be one day, and things like that. So I would disagree that they get the best cares up there in the professional leagues, whatever sport. I don't think that's true at all.
I agree with you because all you do is you see the trainers on the field coming out there and moving the leg. And
sometimes you see a surgeon too, which is surgeries should not be even considered early. I mean, that's the last thing you want to do.
Now, the other part of this question, both Pannozzos are, they also want to know, because of their bodies being conditioned to a higher level, if the medicine used would affect any medication the doctors are putting in now.
Well, they shouldn't be getting any medications. There is nothing to use. We use an anti-inflammatory,
Right.
which is half of it's gone in 4 hours. So nobody's even looking for what we use.
No.
It's purely anti-inflammatory.
I
don't know what they're taking. They shouldn't be taking anything.
I'm just saying, from what I'm depicting from this question, is that they're saying, well, I'm on so many different medications that they're putting me on.
I just answered that.
Right.
They should not be on so many medications
Right.
for a pain. There's
Right.
only one drug you
But
could
that's
use.
the problem. Is that they are putting
that's
a
the
lot of
problem.
medications.
They put on so much medication.
I think that's what they're trying to say between the lines.
But between the
They're
lines,
getting
when
all this
Freddy said-
medication. Why are they on all this medication?
How is this not working?
Yeah.
But so I guess the athlete who spoke to his agent was inquiring, how come?
What you want to ask yourself is, anybody who's operated, is their career gone? Yes.
It's a good question.
Yeah. I got another question for you. Here we go. Hi, you're on with Dr. Pannozzo's. You like the way I said that, the Pannozzo's? You're on with Dr. Pannozzo and the other Dr. Pannozzo. What's your question?
Hi, this is GQ. It isn't a question. It's a bit of a testimonial. Hi, Papa. Hi, Doc. How you doing?
Good.
GQ. Okay.
I just got back from the Carolinas. I was up helping my dad. I left the same week you went to visit your son out in Arizona. And I just got back from up there. But before I get started on anything, I just want to thank you. I went in with what was told I need surgery, 4 herniated discs. I was walking with 2 canes, literally. And by the time I left a half hour later, 3 shots, I was standing perfect. And I haven't had pain one in my back since. I try to go now.
Wow.
I cannot. I've been for the last month and a half up and down ladders, helping my dad fix his house. He's getting ready to sell it up in the mountains, and really busting. And I feel great. I mean, I've got old stuff in my knees. Of course, the doc and I have already discussed this. But yeah, I'm going nowhere else. I'm listening to no one else. It's just unbelievable. I have to tell the people listening, if you're skeptic, take it from me, man. I lived 30 years in chronic pain.
Wow.
My knees, my ankles, my elbows, my shoulder, my back. I was a sports guy and kind of stupid when I was young. And
We all were.
he's fixing me. I'm still a little crazy, but
How long ago did he treat you?
what's that?
How long ago was it that he treated you?
It's about 2 months now, Doc, right? 2 months, 3 months, maybe a little more.
Yeah,
I
probably.
had nothing, no pain.
And no
In
pain until
my
3
lower
months.
back.
There
I
you
know
go.
I have problems with my hips. He found that out before I even sat down.
I mean, he's amazing. He looks at somebody and knows where the problem is.
He do. He
Yeah.
do. I don't call. I call him Mr. Miracle, not Doctor. Hey, Miracle, how you doing?
Well, we call him Miracle, Magic Man,
Thanks a lot. Thanks for calling.
the pain whisperer. I mean,
This is perfectly
that's great.
the history of most of the patients coming in there, and they don't. But the patients don't call in because they're a little embarrassed to be on the radio. But you don't have to give your name. Nobody knows who you are. But you just have to be honest, though. That's all.
Oh yeah, we want to. If someone's out there that Dr. Pannozzo hasn't fixed, call us. Tell us what happened. We don't care.
Tell us the story. We want to hear.
Yeah, we want to hear. You know what? It's like going to a restaurant. You're afraid to tell the person in the restaurant that the food was bad. Well, how are they going to fix it if they don't know?
That's right.
So if you have something that you went to doctor, we take every call. Okay.
And this is a complicated issue.
Yeah, it's very
Dr.
complicated.
Pannozzo worked on me twice. It doesn't mean that somebody with my condition is going to take longer, shorter. And this is a personal condition.
Yeah.
About work and life. This isn't checkers here, guys. This is really serious.
That's why when someone calls up and says, "Well, how much is it going to cost me, Dr. Pannozzo, to come see you?" Well, here's no what's wrong with you. Here's no what's. Is it your hip? Is it your? What amazes me, and it will always amaze me, and I'll keep saying this until the day I die, how you could actually diagnose a patient just by when they're walking. You know where that, and you put it on the machine, and you're 100% right. Does Paul do the same thing, that he can catch something that fast?
Yeah, pretty much.
Yeah. Wow.
4 herniated discs, he said. 4.
Wow.
That's
that
amazing.
comes from an MRI. See, that's why we don't get MRIs. They're relatively ineffective. They overread things.
Amazing.
I remember a patient of mine who used to work for Disney, by the way, drew pictures. Anyway, he had a bad shoulder. MRI said everything was ripped out. I said, what? Come on in. So when he left, his shoulder was normal. It was moving everywhere because there's nothing ripped out. You can't rip anything.
That's amazing.
I mean, so this guy.
If you have a backache, MRI is really not helpful.
No.
If it's down the leg, MRI can, if you have a nerve that's, irritated or something, something affecting it, you want to find out what, just a disc, a cancer, who knows what. So MRI is good, but for a backache, usually MRI doesn't help. Sometimes you can treat them just with an X-ray, staining film. I mean, if they don't get better, you can consider it to make sure you don't have like a fracture of a bone or again cancer in there or something. But their exam is different. They're really, you can't really. I should say generally you can find the pain on the exam if it's going to something, you can figure out what it is. You don't need the MRI. But if you have backache, MRI is saying, hey, it's 4 discs, but that's probably not it.
Yeah, well, what he's describing is we don't like to spend a lot of money doing tests.
Mm-hmm. No, I agree.
Pain diagnosis is on a clinical basis primarily. You have to know pain patterns, what the structure is supposed to do, and what happened to it, and then you can put it together. That means a hip, knee, shoulder, ankle, anything like that. The special film we do is I have a patent on it.
I know. I know.
You're not going to get that anywhere in the world except for in our offices.
Maybe when you retire, we could go 20 million. You think for that? What do you think? 20 million? Why not?
I don't know. Pipe dreams. No. But anyway.
Well, the amazing thing is, me being a normal person, I hear 4 herniated discs. I'm in pain. I mean, all these things are playing. When the doctor's telling me this, I'm crying.
Well,
that's painful.
Terms they use, like herniated discs, don't really mean anything. Those are all ligament sprains. The annulus, what holds a disc in, the disc is semi-liquid inside, by the way. It's not where the pain is. There is no pain on the disc. It's on the annulus, the ligament around it. So you can't have a herniated disc, because that doesn't happen. I mean, you have to have a sprain of the annulus, which is a ligament. Okay, if you know where that is, you can easily treat that, and the pain leaves the same day. If you don't know about it, if you're a bulge disc, what does that mean? It doesn't mean anything.
They show you picture. There's a big bulge.
Right. It's the annulus. Actually, the problem's on the other side.
Exactly.
Or it could be on the same side. So you don't know. You have to examine for it.
But the fear on the person that doesn't know anybody, the fear is tremendous, Doc.
Well, I
have a heart attack.
Well, you're talking about all these surgeries that are made on knees and hips and all that. It's all done by the MRI.
Yeah.
They recommend that, and and you're sold on the prospect that the MRI is God's gift to humanity. It tells you everything that's in there. That is absolutely not true.
And what Freddy just said is true. I mean,
It's fear.
The fear. His doctor says you got 4 herniated discs. We got to operate right away.
I'll operate you tomorrow.
And this guy was smart. He went to. And my God, I mean, just think about that. I mean, that
30 years in pain? How do you live in 30 years in pain?
Well, because you don't know any better.
That's right. And that's what we're talking to, the people that don't know any better. Well, now you know better.
So
Come and get looked at.
I can see Colleen tell me I have about 2 minutes left. So
Get a bigger building, Doc.
Dr. Pannozzo, Paul, give your number again before we go up in Arizona.
623-776-8686.
And next time you got to call us a little earlier so we can keep you on. Thank you so much for calling
West
the
of the
show.
Mississippi, go see him.
West of the Mississippi. And Doc, everybody, you want to call Doc after our show, you can call him at 561-381-5800.
That's right.
And he'll answer the phone. He'll talk to you. He'll tell you to come on in. And I'm going to tell you, after hearing that guy's story with the herniated disc, out of all the things we said today, that has got to be amazing to be able to have that pain for 30 years.
That must hurt.
Well, I give the guy a lot of credit for 30 years. He didn't go for surgery.
No, and now he's jumping up and down stairs. He's Superman.
I mean, just think. In a couple. Oh, well,
you shouldn't have given out the
I'm going to
number.
let Dr. Pannozzo take this call. Thank you, everybody,
All right,
for
see ya.
listening. We will
show,
talk
guys.
to you next Sunday. I'm going to Vegas. If you don't see me, that means I broke the house and won a lot of money.
Dr.
Have a great
Pannozzo.
day.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.
News, traffic, weather.